Namaskar. Let us talk about one of the very common medico-surgical problems observed in males after the age of say 60 years. It is benign prostate enlargement, BEP. It is also called benign hypertrophy of the prostate. It might sound very complicated, but it is very simple. What we understand by the word benign is something harmless, or in other words, it is non-cancerous. Something which is no cancer is benign. Benign hypertrophy or enlargement. Hypertrophy means the kind of enlargement or swelling and of the prostate gland, which is a gland in all the males. And when is a process of aging, this prostate becomes enlarged, it becomes hypertrophied, it swells up. It also gets little scarred, and that happens after the age of say 55 or 60 in many males. Almost 60% of the males after the age of 60 years, they seem to have some symptoms of prostate enlargement. And it is very important that we rule out that this prostate enlargement is not cancerous. That can be done very easily by a blood test called PSA, that is prostate specific antigen. This blood test will help you rule out most cases of malignancy or cancers of the prostate. Once you establish that this is a case of a benign hypertrophy or a non-cancerous growth of the prostate gland, then the options are that one may either go for surgery or one may take medicines. Surgery is indicated usually only if the enlargement is very severe, the size of the prostate gland in sonography is shown to be bigger, and if it has grown thick and heavy in the weight. So if the growth of the prostate is such that it becomes very heavy, that can be measured again by the sonography report. And if the residual urine, that is after passing urine, some amount of urine still remains in the urinary bladder, that is called residual urine. And as a result, once the urine still remains in the bladder, the person will keep having more frequent urge to pass urine, because some amount of urine always remains there. The moment some more urine is getting added, one gets an urge. So as a result, the patient may experience to get an urge to pass urination, say every 2 to 3 hours. Sometimes it may be 3 to 4 times even at night. So these are some of the basic symptoms of prostate enlargement. What does homeopathy do? Well, prostate enlargement or BEP or BHP is essentially a medico-surgical condition. It means eventually it may require surgical correction. But homeopathy has some role to play to slow down this disease progression. Homeopathy has some role to play to give symptomatic relief in the cases of prostate enlargement. Homeopathy may not cure each and every case of prostate enlargement and may help you avoid surgery, or it may help you delay the surgery. But we cannot say that homeopathy can guarantee that one may not require surgery whatsoever. So with that understanding, one should approach homeopathic treatment. Clinically, it has been shown that homeopathic medicines work very well for many cases of prostate enlargement. We have seen that patients have relief in the symptoms. You've seen that the prostate growth slows down, it becomes stable or static and doesn't grow that rapidly after starting homeopathic medicines. Of course, some patients do show the growth continuing even after homeopathic medicines, because it is, as I said, is a surgical condition, but we try to treat it with homeopathic medicines and try to see that we can help this patient to a certain extent. Eventually, if patient does not respond, one may have to go for surgery, but as on today, the surgery success is not so 100%. So it is recommended that unless it is absolutely mandatory or important to go for surgery, one should try to follow the medical line of treatment. That is where homeopathy has a role to play. So this in brief is the understanding about the role of homeopathy for benign prostate enlargement or benign hypertrophy of the prostate. I hope this video will help and guide patients who are seeking help using homeopathy for this condition. Thank you for watching.